Bismillahirrahmanirrahim. Bismillahirrahmanirrahim. Assalamu alaikum. This is Laiba Manover, course PHP 705, Prof. 5th year morning, roll number BP 1450096. Topic Nevirapine drug. Nevirapine Viramune. Nevirapine Viramune is a potent non-nucleoside reverse transcriptase inhibitor used combination with nucleoside analog for treatment deficiency of HIV. Rational use of nevirapine drug. It helps to reduce the amount of HIV in our body and it can help immune system for better work. That's why less chance of HIV such as cancer. Nevirapine belongs to a class of drug known as non-nucleoside reverse transcriptase inhibitor. Irrational use of nevirapine drug. It helps to reduce the risk of spreading HIV infection to others. If we intake all the HIV medication daily to prescribe, your doctor does not use an effective barrier method, polyurethane dental dams during the sexual activity, doesn't share the personal item such as syringes, toothbrushes, and the razor. It can be conducted with the blood and the body fluid. Nevirapine is not used to prevent the HIV infection after accidental exposure, such as needle stick, blood, body fluids, and we use the different HIV medication to cure the infection. Drug-drug interaction. Carbamazepine and the nevirapine affecting hepatic enzyme CYP3A4 result in loss of virology response. Cariperazine and nevirapine CYP3A4 it is a formation and the elimination of active metabolite. Efavirenz and the nevirapine is a risk of immune reconstitution syndrome. Rilpivirine and the nevirapine not combination with the NRTIS. Alternative of drug. Sustive efavirenz 1 dose. Intalence etavirine 1 dose. Delivirdine 1 dose. Now the chart. There is a chart which shows the full amount of dosage from adult. In adult, the oral suspension 10 mg/ml, pediatric 10 mg, uh, 10 mg/ml, HIV infection 200 mg, POX 14 days. Pregnant woman prescriptive report exposure 2600. In adult, the immediate release of 200 mg, pediatric 200 mg, HIV infection, no rash 200 mg in 12 hours. And in pregnant woman, first exposure is 1100 trimester. Now in adult release of 100 over 400 mg, the pediatric 100 over 400 mg, HIV infection, initial therapy of 200 mg for 14 days. Now the pregnant woman second and the third exposure is 1500 trimester. Drug toxicity mechanism. Nevirapine is the non-nucleoside reverse transcriptase inhibitor. Both inhibit the same target. RT enzyme are the viral enzyme RNA and into DNA. It is bind to polymerase active site. Resistance to drug development rapidly if HIV viral infection use resistance drug efavirenz delivirdine second generation in the rilpivirine and etavirine. Indication. Viramune is indicating in the combination with the antiretroviral agent with the treatment of HIV infection in adult pediatric patient in 15 days. The side effect is the rashes, joint pain, muscle rashes, itches, fever, the loss of weight, and severe tiredness. Now the case study. There is a case of a 47-year-old woman came to hospital having a complaint of fever 103 Fahrenheit, non-productive cough, dyspnea for 1 week, having a previous history, HIV positive. 5 years ago, her CD4 lymphocyte count was 583 at the time of zidovudine was started, but stopped taking it after a month. She has no sexual activity history, but having a heroin and cocaine addicted for 6 hours. No smoking and alcohol history. Now she has anorexia nervosa and lost her weight up to 7 pounds over last 3 months. Subjective information of the past history. Previous history is HIV positive, having a low CD4 lymphocyte count 583. To take zidovudine for a month to treat HIV positive, no sexually abused past history, heroin plus cocaine addicted, no history of alcohol and smoking. Medical history. The past medical history of a patient is the HIV positive 5 years ago, anorexia nervosa 3 years ago, present diagnosis HIV positive. The objective information fever 103 Fahrenheit, difficulty in breathing, non producing cough, weakness, dyspnea, fatigueness, skin rashes, and sore throat. Assessment. Pale skin color, acute respiratory distress, crackless sound present on the examination of vital sign. BP 107/70, HR is equals to 90 bpm, oxygen saturation is equal and greater than 90. Having a tricardia but no murmur, no side effect of abdomen, spleen, etc. Neurological examination is normal. Treatment plan. The treatment plan of a patient is Nevirapine drug is recommended to treat HIV infection. Dosage form in severe infection of HIV-1 viruses, so recommended immediately Nevirapine is equals to 200 mg in 12 hours. After situation handle, consider oral supplement of the Nevirapine drug 200 mg over for 14 days. Thank you.